Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Every day, millions of CT scans and MRI examinations are performed around the world. Within minutes, incredibly detailed images appear on computer screens. Doctors examine bones, organs, blood vessels, even tiny abnormalities hidden deep inside the body. But here's something that surprises almost everyone. The scanner doesn't actually create those pictures. In fact, immediately after your scan is finished, there aren't any pictures at all. Instead, your examination begins as millions of measurements and mathematical calculations. Only after powerful computers reconstruct that information do the images your doctor sees finally appear. Today, we're going behind the scenes to uncover one of the biggest secrets in medical imaging: how computers transform invisible data into life-saving pictures. Although CT and MRI use completely different technologies, they share something important in common. Neither scanner captures photographs. Instead, they collect information. In a CT scan, detectors measure how many X-rays pass through different parts of your body. Dense structures like bone absorb more X-rays. Air absorbs very few. Every rotation of the scanner collects thousands of measurements from different angles. MRI works differently. Instead of X-rays, it detects tiny radio frequency signals released by hydrogen atoms after they've been excited by a powerful magnetic field. Those signals contain enormous amounts of information about your body's tissues. But here's the important part. None of that information looks like a picture. It's simply raw data. Imagine recording every musical note played during a concert, but hearing only individual sounds instead of the finished song. The information is all there, it just hasn't been assembled yet. This is where some of the most impressive computing in modern medicine happens. The scanner sends enormous amounts of raw information to powerful computers. Using advanced mathematical algorithms, those computers calculate where every measurement belongs. Piece by piece, line by line, pixel by pixel, the image begins to appear. For a CT scan, the computer reconstructs hundreds or even thousands of thin slices through the body. For MRI, it reconstructs images from complex signal patterns collected during the examination. What started as streams of numbers slowly becomes something doctors can actually interpret. The images may appear almost instantly on the screen, but behind every picture is an extraordinary amount of mathematics happening in just fractions of a second. Image reconstruction isn't just about creating a picture, it's about creating the best possible picture. The way a computer reconstructs an image can influence how clearly tiny anatomical details are displayed. It can reduce unwanted image noise, improve the visibility of subtle structures, and help healthcare providers interpret examinations with greater confidence. Modern CT systems use sophisticated reconstruction techniques to balance image quality with radiation dose, while MRI systems use advanced processing to improve image clarity and reduce artifacts. The goal isn't to change what's inside your body, it's to present the information as accurately and clearly as possible. Think of it like adjusting the focus on a camera. The scene never changes, only how clearly you can see it. Here's something that surprises many people. One CT scan doesn't produce just one image. It can produce dozens or even hundreds of different versions of the same data. Imagine taking one photograph with your phone. Now imagine instantly changing the brightness, contrast, and focus to highlight different parts of the picture. That's similar to what image reconstruction allows in medical imaging. Using the same raw data, computers can create images optimized for different tissues. A bone window makes fine skeletal detail easier to see. A lung window highlights tiny airways and lung tissue. A soft tissue window helps visualize organs like the liver, pancreas, and kidneys. The anatomy hasn't changed, only the way the computer displays the information. This flexibility allows radiologists to evaluate the same examination from multiple perspectives without exposing the patient to another scan. As computers became more powerful, engineers developed a smarter way to reconstruct CT images. It's called iterative reconstruction. Instead of creating the image just once, the computer repeatedly compares the reconstructed image with the original raw data. Each comparison allows the software to reduce unwanted noise and improve image quality while preserving important anatomical detail. Think of it like solving a jigsaw puzzle. At first, the picture is incomplete. With every new piece you place, the image becomes clearer and more accurate. That's essentially what iterative reconstruction does. It continually refines the image until it closely matches the information collected during the scan. This technology has helped produce cleaner images and, in many clinical situations, has supported the use of lower radiation dose while maintaining the image quality needed for diagnosis. Today, another exciting technology is becoming part of image reconstruction: artificial intelligence. Modern AI algorithms can help reduce image noise, improve sharpness, and accelerate certain reconstruction processes. Some MRI systems now use AI-assisted reconstruction to shorten scan times for selected examinations while maintaining excellent image quality. In CT, AI-based reconstruction methods can produce cleaner images that may improve visualization of fine detail. But it's important to understand what AI is and isn't doing. AI isn't inventing anatomy. It isn't creating diseases that don't exist. Instead, it's helping process the information collected by the scanner more efficiently and consistently. The final images are still reviewed by trained healthcare professionals, and every examination is interpreted in the context of the patient's medical history and clinical question. AI is becoming a powerful tool, but it's one tool among many in modern medical imaging. Medical imaging isn't always perfect. Patients may move, metal implants can interfere with X-rays, electronic noise can affect image quality. Fortunately, modern reconstruction techniques help address many of these challenges. Advanced algorithms can reduce image noise, minimize certain artifacts, and improve the visibility of important anatomical structures. Some systems can even compensate for small amounts of patient movement, although remaining as still as possible during the examination is always important. These improvements don't replace careful scanning techniques or expert interpretation. Instead, they help imaging teams make the most of the valuable information collected during your examination. It's another reminder that today's medical images are created through an extraordinary partnership between advanced scanners, powerful computers, and skilled healthcare professionals. Image reconstruction has evolved tremendously since the first CT scanner was introduced in the early 1970s. Back then, reconstructing a single image could take several minutes. Today, incredibly complex calculations happen almost instantly, and the technology continues to improve. Researchers are developing faster reconstruction methods, smarter artificial intelligence algorithms, and more advanced computing systems capable of processing enormous amounts of imaging data. Cloud computing is also beginning to play a larger role in some healthcare environments, allowing sophisticated processing and collaboration across different locations while supporting secure workflows. Future reconstruction techniques may help produce even clearer images, reduce artifacts further, and provide additional quantitative information that helps healthcare providers monitor disease over time. Interestingly, some of the biggest improvements in medical imaging may not come from building larger scanners. They may come from building smarter computers. Every improvement in reconstruction allows healthcare teams to extract more meaningful information from the data they've already collected. And that's an exciting future for both medicine and patients. When most people think about a CT scan or an MRI, they picture the machine,
The scanner.
the table, the tunnel, the images. But behind every medical image is another story, a story of mathematics, engineering, computer science, and decades of innovation working together in just a few seconds. The scanner collects millions of measurements. Powerful computers organize that information. Advanced reconstruction algorithms transform invisible data into detailed medical images. And trained healthcare professionals use those images to help answer some of medicine's most important questions. Every breakthrough in image reconstruction has one purpose: to help healthcare teams see the human body more clearly. Not because clearer images are impressive, but because better information can lead to better decisions. And better decisions have the potential to improve patient care. The next time you see a CT image or an MRI scan, remember, you're not just looking at a picture. You're looking at the result of millions of measurements, extraordinary mathematics, and some of the most advanced computing in modern healthcare. Because every image tells a story, and sometimes the computer tells it first. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed learning about the incredible technology behind medical images, please like, subscribe, and share this video with someone who loves science, healthcare, or technology. And if you'd like to see how CT scanners can build detailed 3D models of the body, check out our short links on the screen now. We'll see you in the next one.